Hello and welcome, listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC here at GOLD. And here at GOLD, we are right now preparing for our GOLD Obstetrics Online Conference of 2020, our second annual conference here at GOLD. And with me here today is one of our speakers, Dr. John Barrett. Welcome, Dr. Barrett.
Hello, hi.
It's wonderful to see you here, and I see at your background, this is your hospital, right?
Yes, that's right. And it's a virtual background at Sunnybrook Health Science Center in Toronto, Canada.
Oh, wonderful! That's fantastic. Tell us a little bit about yourself, your background, and your work at the hospital, at the center there.
Yeah, so I'm an obstetrician. I was born in South Africa. I trained in the UK, where I did a doctoral thesis as well as my obstetrics and gynecology, and then came to Canada in 1992 to do a fellowship in maternal fetal medicine, and end up staying. Started off at a hospital called Women's College Hospital, which was one of the perinatal units, which then amalgamated with Sunnybrook, which is one of the biggest teaching hospitals. I've been here about 10 years. I've been involved in research all my life. Started Canada's first twin clinic in 1996, just at the beginning of the huge increase. And I've really that's really been my career, mostly in research, and now I'm more focused on quality and networks in improving healthcare outcomes.
Wonderful, wonderful. So you started the first twin clinic. That is absolutely exciting there. I know you also work with you're on the board of an advisory board there at the World Health Organization.
Yes, that was a while ago. The WHO were looking into maternal morbidity and mortality, and somehow got my name and spent some time in Geneva. That was very exciting. And one of my passions now is to try and get a confidential inquiry into maternal morbidity and mortality in Canada, because we don't have that here like many parts of the world do. And as I said, I've become a lot more focused in improving quality and outcomes, sort of implementing research findings as opposed to finding them. So yeah, that all kind of links together.
Wonderful. Yeah, it's interesting to know. I had no idea that that study was not conducted in Canada yet. That's interesting.
Yeah.
Interesting. Yeah, and quality. Why is it? And this is not related with your to your presentation, which I come to in a minute. Why is it that it takes sometimes so long to take research and put it into practice?
You know what? That's a great question. The reason, I think part of the problem is in the science of quality improvement. We don't close the loop between what we know and implementing what we know well enough. I think part of it is we don't engage patients from the beginning. That's part of the problem. We don't design that. Part of the ways we do it is we don't have good research structures. We wait for individuals to have good ideas, and convince everybody else to decide how, to help them implement it, rather than deciding as a group what our priorities are together with patients and then implementing it. Some of it, I think, has got to do with pure statistics, the way we design trials. I'm not sure we got it right. I understand traditional statistics and p-values is scientifically good, but it takes a long time to get. And I'm just wondering whether one of my areas is looking at Bayesian analysis methods to look at we can get answers quicker. One of my pet projects really is actually started by a colleague of mine from Australia, William Tano Mordi, who started something called the Alpha Collaboration, which is people across the world collaborating together to do large studies, which will show important differences in large sample sizes, but small differences. So that's a great interest to work together collaboratively to answer the same question.
Yeah, fascinating. Yeah, very interesting there. Now let's talk a little about your presentation here. It's titled Twins in 2020, All You Need to Know. Whoa, that sounds like you're going to pack a lot of information in 1 hour, right? For us here.
Yeah, I think, I tried. I think really it's fine. It's a good cook's tour between highlight the main important area, but obviously in an hour, you can't get into detail into any one particular area. So I think, maybe in the next time we should take each one of those and give one presentation on each of it rather than the whole thing. But and I hope it gives viewers just some idea of some of the areas of interest in twins. Yeah.
Absolutely. Yeah, you're right. An hour is short, and yeah, wish we had more time there for that. I'm a midwife. I'm here in South Florida, but for twins, I cannot deliver twins. I have to risk that out too, obviously, to a neonatologist and there as well. So twins for us here, when I look around in the hospitals in my area, are mainly delivered by C-section. So tell us a little bit about your work. Is that mainly the case in your clinic there as well, or are we seeing some more vaginal deliveries? I would love to see more vaginal deliveries
Yeah,
of
so I mean,
twins.
the reason we did the twin birth study many years ago was really to try and define which is the best and the safest method, vaginal birth or cesarean section. And the answer is pretty clear. Vaginal birth results in just as safe outcomes as cesarean section. So there is absolutely no need to perform a cesarean section just if the first baby's head down between 32 and 38 weeks in order to get to the same outcome, as long as the obstetrician is experienced in delivering twins. If they're not experienced, they don't know how to do it, then they shouldn't. And then cesarean section is probably safer. But if you're trained, and there's no reason you shouldn't be, then there is actually no reason to do cesarean sections. Now, why do people still do that if the evidence is pretty clear
Mm-hmm.
that you don't have to? And unfortunately, I think that's, I wrote an editorial recently, the way that we implement scientific findings very much depends on our bias. If you can take the same excellent trial, perfectly done, if it fits with what we believe, then we are more likely to implement it.
Mm,
If it doesn't fit with what we want to believe,
right.
then we don't, which is exactly why we were not supposed to do randomized control trials in the first place. We were supposed to do randomized control trials to eliminate bias, but we don't do that. We use the trial and we implement them depending on how biased we are towards the outcome, which is
Mm-hmm.
unfortunate, and because
Absolutely.
it results in what you're just saying. In South Florida, people are having cesarean section for twins all the time. There's no need to do it. Why is it happening? It's because in that part of the world, there is a bias towards cesarean section for
Mm-hmm.
whatever reason it is. And it's unfortunate because medically it's not required.
Right. I mean, it's wonderful that the researchers there saying that it is safe, and but I think it also comes down to training. You mentioned something very important there, that the physician has to be trained or experienced in delivering twin births there. So when the baby A is set down, and that's great, but often baby B is you know uh, in a breech position, and often, and that's where it starts, right? Many physicians don't have the efficient training for delivering often a breech. Often breech here is also done as a C-section in most
Well, see that
cases. So
exactly, but you see what people have to realize that a second twin breech has got nothing to do with a singleton breech.
mm,
So they second twins are smaller. You've just
right.
had the first baby delivered.
Hmm.
Second twin breeches never get stuck. They never
Hmm.
do.
Hmm.
I've never had. Oh, never is a hard word. I've never heard of it. It's never happened because
Right.
they tend to. And as long as you select them, you make sure the second one's a little bit smaller, not very much bigger. There's no reason to fear what you fear with the singletons. And the
Hmm.
outcome for the breech trial should never be extrapolated to twin birth study. I think people
Hmm.
do it because, as I've said to you, it's
Yeah.
easier for them to do it because it's
Yeah.
easier for them to schedule a cesarean section. But the
Hmm.
evidence is pretty clear.
Hmm.
Now, you're
Interesting.
quite right. If people aren't getting trained to do it, that's a problem. And that is why I think general obstetrics skill is in danger.
Yeah.
And I think we are in danger as a profession of losing the skill of what it means to become an obstetrician. And I honestly believe that.
Interesting that you thank you for saying that. That's interesting. Another argument I hear a lot is, oh my goodness, prolapse, right? So yes, baby might be smaller, maybe easier, but then if it shifts into transverse position or something happens, and then we have a cord prolapse, and then everything is, of course, um, not a good outcome. So
No, but see,
that's an
that's not true. If you do it the way that I said you do it, and you're in the
uh-huh.
right place, and you're in the operating room, and you're there with the anesthesiologist, and at the cord prolapse, you just grab the foot and pull the baby out quicker than you can
Mm,
do anything. It's only a problem if you don't know what you're doing and you're in
right.
the wrong place.
Right. Okay. Well, thanks for clarifying that for me here. Thank you so much. I am looking forward to this presentation. I know I can learn a lot in this, and I hope many of the colleagues here, and not only in South Florida, but worldwide, are viewing this presentation and getting good, solid information here on twin birth, twins, all we need to know in 2020. Thank you so much, Dr. Barrett.
It's a pleasure. Thank you, Kristen. Bye.
Thank you so much. And for our listeners, this presentation is part of the GOLD Obstetrics Online Conference of 2020. The conference will start November 9th. That's just around the corner. And if you would like to find out more about this presentation here by Dr. Barrett and the other presentations in the conference, please go to goldobstetrics.com. Thank you, everyone, for listening. Bye-bye, everyone.
Bye-bye. Thank you.